So I want to actually talk a little bit about Lori's. So Lori is another holistic pet health coach who is amazing, and she is also a certified canine massage therapist like myself. Um, and by the way, I'm Michael Daly. I'm sitting in for Dr. Roberts for the holistic pet health coach. She's on a press tour doing tons of speaking engagements for everything that she is doing for the website and the coaching program and holistic medicine and things like that. So she's doing that while I am taking over for her for a little bit. And for each one, I'm talking to a couple of pet health coaches, and Lori is one of them. This is her website, thepeacefulpaw.com. And Lori not only is a holistic pet health coach and a massage therapist, but she also sells natural pet food and pet treats, and candles and sprays and things like that. So I was going to have her actually do a lot of the talking about this, but unfortunately with our connection, she's not going to be able to. So hopefully I can get her back on and have her talk to you. But if you go to her website, thepeacefulpaw.com, you can kind of go around and look around for it. She's got some great treats. They're all natural cranberry treats, little shaken bacon, which is really cute, nut treats, some sweet potato treats, things like that. And then here she is. She's also a professional pet massage therapist. So let's see. So Lori Gammon Meganson. I'm sorry, it's three names. I always call her Lori McGammon. She's a certified practitioner who brings 5 years of expertise to every session. Through the power of touch, this specialized therapy offers a wide range of advantages for your beloved furry pet. By targeting areas of discomfort such as stiffness, inflammation, and muscle spasms, dog massage therapy effectively reduces pain and promotes increased comfort and mobility. Your dog will experience improved muscle tone, enhanced spinal and body alignment, increased flexibility, and wide range of motion. These physical improvements contribute to a healthier and more active lifestyle for your canine companion. Absolutely. And so unfortunately, which is so frustrating because we are both canine massage therapists, so I'd love to have a talk with her about this for y'all. But I've been doing it since 2011, and it is, it's one of those options out there that we have available. With aside from having, going to the vet and getting the normal non-steroidal anti-inflammatory medications, or things like tramadol or gabapentin to help with pain, massage can be very beneficial, especially for older pets. And not just for older pets with arthritis, but with older pets, with other pets that have had surgeries from injuries like ACL tears, or for pets that are sports pets. Massage is really beneficial for preventing injuries. So that's really the thing with massage. A lot of people look at massage and they say, oh, well, my dog is injured, he needs a massage. And massage is not, it can be used for that, but massage is more about using it for prevention. It's all about prevention. So it's a great option out there that doesn't have side effects other than a pet falling asleep. Let me see if Laura's got some pictures in here. We'll go to her little pet services section. So that's the massage. And then also she's a holistic pet health coach. And Lori actually lives about an hour from me. I'm in Charleston. She's in Murrells Inlet. So it's great. And then you can download a great little brochure she's got here for the benefits of massage. This is sort of the face you get when you get a massage from the dogs give you. So, like, I'm not sure if Lori's like me, but I massage every animal. So I've done cats, I've done dogs, I've done goats, I've done sheep, I've done a deer, I've done monkeys. I was talking to one of the vets at the Charleston Aquarium. She actually wanted me to come down and massage the turtles even, which I didn't know that could be a thing, but to help with just increasing blood flow in their fins and things like that, because we have a big sea turtle rescue here. So haven't gotten a chance to do that. But so massage along with acupuncture is another element you can do. Cold laser therapy is another element that you can do. Chiro is another element that you can do. So there's a lot of things out there. Lori is really great at what she does. I'm so angry that we're having some technical difficulties with this. I'm gonna actually see if she can I hope she's watching still. Maybe if I share again, the sound will come on. Lori, if you're watching, can you try to talk and see?
Can you hear me?
Ah,
Yes? Yes, no, maybe?
yeah.
No? Darn.
I know.
You're doing a great job, though.
I'm sorry.
Okay.
All right. So once again, I'll go back to Lori's website. So it's at www.peacefulpause.com where you can contact her, and we'll have her back on and make sure that she can talk to everybody. I'm so frustrated. All right. So let's see. I was going to go into some of the questions that we had on the holistic page. I have a lot of things pulled up, y'all, so let me find it here. All right. I'm going to go from top to bottom. So these are questions that have been asked on the Facebook page Holistic Pet Health Group from Dr. Roberts. And let's see, we had a lot of people joining. People are joining every day, which is really, really great. So, and we have a lot of the other pet health coaches on here to help with answering questions. So, and this is really interesting, this one question. So it's just which is a tough one from Paige Thomas. So let's see, physical trauma causing neurological-like symptoms in a cat. Please, no negative comments. We have 4 cats. We let one outside. Yeah, no, yeah, and that's okay, Paige. We're all watching this, so if there's any negative comments, we'll make sure, because I know some people are really, they have their feelings about an outdoor cat. My cat was outdoor. He's indoor now, but I know. So Tigger went outside last night and came home this morning and unable to walk. The only signs of physical incident were some dried blood in his back, foot, and his fur was a little disturbed in some areas. He has 0 lacerations or wounds. I immediately took him to the vet. He was given an examination by multiple veterinarians. They did not feel any broken bones. They performed general blood work to rule out toxins and infectious disease. Good. His blood work came back normal. Good. They observed him for a few hours. They sent us home with gabapentin and prednisone, said to come back next week for more diagnostics. If there is no improvement, it is bizarre because he's acting kind of normal. He is purring. He licked me. He wants to be close to us, crawled in my husband's lap. We have him confined to our bedroom, prefers to lay out on our bed versus hiding underneath it. He really trusts you. I put food in front of him on the bed and he chowed down while we laying there. Good. We removed the cat tree from our room, but he climbed up as best he could. Buddy. And he jumped up on our bed, which I will try to not let him do moving forwards. Oh, little man. We are at a loss. He is half himself, half completely messed up. Warning, the videos are hard to watch. I attached the vet summary. I have no notice of head tremors since we have been home. If anyone has suggestions or input, it would be appreciated. Thank you so much in advance. Well, watch these little videos of baby boy. Oh, my man, that left. Oh, that's his right foot sliding under. Okay. You can notice, let's see. Left front, he's not feeling necessarily. Little man. Okay. Ooh, okay. This one. Poor guy. he's got. So he's able to bear some weight on that back left and back right. It's that left front that, oh, there he goes. Sometimes it's hard to see. There he goes. Okay, well, he's using. It's almost like vestibular. Oh, I was watching it and the video stopped. Sorry. Let me see what the vet had said. Thank you for coming in for the signs you were seeing with Tigger. Abnormalities noted on physical exam are his uncoordinated movement gaits and decreased sensation in his left front limb. Yeah, he has intermittent head tremors that was inconsistently observed during hospitalization. Today performed systemic blood work, which was showing mild changes associated with stress. Okay, all other values were normal. Our recommendation is to start a pain anti-inflammatory medication for possible traumatic injuries. We recommend monitoring for any signs of infection, such as bloody discharge, pus, swelling, or foul odor. At this time, we did not observe any signs of infection, but if you note these symptoms at home, please let us know. We can start antibiotic therapy as well today. We updated his rabies vaccine in case of a possible bite from another animal. I don't know why. We recommended monitoring his symptoms closely over the next week or so. If any new symptoms arise or you are not seeing any improvements in his gait or functioning of his left front limb, we recommend a recheck exam and further diagnostics. Thank you for entrusting us with Tigger's care today. Please feel free to call us with any questions or concerns. You will receive a link to certain. Okay. I would not have recommended a rabies vaccine, especially if your pet has already had one last year. Rabies can stay in your system for 3 years or a little bit more. So you already have a pet dealing with a type of inflammation. So why you're adding more inflammation to a pet, I wouldn't be worried about rabies. That's sort of the last thing I would honestly worry about as a technician. I mean, let me reference saying I'm not a vet. Plus you're getting prednisone, which is going to hurt his immune system. So you're giving him a vaccine that's going to cause inflammation with a drug that's going to break down his immune system. So why a rabies vaccine? That's sort of the last thing I would have thought a vet would do. But that being said, prednisone, or what is he on anti-inflammatory medication? I don't think you said, I was looking at the comments earlier. Let's see, Teresa Perez, my guess would be head trauma, maybe just swelling, will get better with time, or his pupils even. I was sort of thinking nystagmus too there, Teresa, if you're kind of with the pupils, if you're thinking that's where you're going. Paige answered, yeah, thank you. Yeah, thank you. He is better today. Oh, good. Paige, still walking, really messed up, but definitely improvement. Good. It's still weird though. Paige, hope he continues to improve. Paige, his pupils are fine. Okay, so maybe some spine stuff too. Where did I see? Oh, I think you had it in that. Sorry, y'all. It's just a lot of. All right. Oh, they sent us home with gabapentin and prednisone. So they sent you home with a Neurontin, which is gabapentin, to help with. So gabapentin's job is to help get the signals to the back. So it helps with signals. So that would help with the idea, I think, behind that was with the issue with the left front, that signals aren't getting to it. I can't tell really so much with the walking in the back legs. I thought I saw a little bit of issues with that, but he seemed to catch himself okay. So that's what they're doing with that. Just FYI, gabapentin does cause drowsiness. So you're sort of helping that with the Neurontin, but also maybe causing drowsiness. So just watch for that. Prednisone, Of course, I think that's a good idea with what's going on. Get the big guns on them because it's a really, really hardcore, very strong natural inflammatory. Of course, it's something that you don't want to be on for the long-term side effects. Um, Rabies, I don't agree with. So I'm glad he's doing better. It's hard to say. It's so tough to say on that Facebook post. So if he is doing better, basically we're looking at a major type of, inflammatory issue going on. So we want to do everything we can to help decrease inflammation for this guy, and also support him. So, as a pet health coach, we gear towards helping the gut, pills, and things like that to help with that. It's so hard to say what is causing it. And also, you may want to ask them if you feel like it's getting better. I still think it would behoove you to possibly get a CAT scan on him, just to maybe rule out any sort of cancer thing going on, maybe head tumor or something like that, brain tumor, that's causing the issues as well. That may be a good idea just to rule out that. It's sort of that situation where it's like I can throw out supplements to you, but right now he sort of needs the big guns going on. Um, so yeah, but I think like just to if it makes you feel better, I think aside from the rabies vaccine, the prednisone and the gabapentin are a good idea, and I'm glad he's feeling good. So yeah, I would just see how he does. He's getting better, and then start gearing him towards a more pro-inflammatory diet. If you're not home feeding him already or home cooked feeding for him already, there is a crock pot recipe for cats. That is available. And also there's a lot of us coaches that can help work with you and kind of get more. This is difficult because need a lot more information with him and see how he's doing. But there's a lot of more natural inflammatories that you can use to help him in the future once he gets past this hump, and get a specific diagnosis, since there really isn't a specific diagnosis right now. So yeah, but keep us posted. Poor baby. All right. Rika, apparently in New York City, there is a big issue with contaminated rat urine and feces causing the bacterial leptospirosis infection. Any recommendations on holistic prophylaxis? We have a 10-week-old puppy. I know charcoal is the first defense, however, not sure, as New York City is a tough place with a lot of rat poison rats, rat urine, and rat bottles. Thank you. So I was looking this up, Rika, and it looks like there's only about 20 cases of leptospirosis. For pets in New York, even with the urine in puddles. So leptospirosis is a bacterial infection, y'all, that can be caused. Pets can get it when you live in a wooded area, because raccoons or wild animals will urinate in the water and pets will drink it, or look on their paws and they'll lick it. And it is zoonotic, so it can be transferred over to humans. So you have to be careful. And so lepto is also a vaccine that is not really fully effective, and it lasts maybe about 6 to 8 months. So you do have to get it regularly, and it is the one vaccine in the history. So I've worked as a vet tech for almost 20 years, and it is the one vaccine that I have seen the most reactions from. So here in Charleston, it's a very wooded area in some places, especially Johns Island, where I worked with Dr. Roberts at Some Dog Cat Moon. And we very, 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 very rarely gave a leptospirosis vaccine even then. It's one of those situations where the side effects of the vaccine outweigh the chance of getting lepto. Now, if you were like a hunter and you had dogs that it's like if you have pets that you have that are in the woods, you let them off leash, they can get into that kind of stuff, then it may behoove you to get the leptospirosis vaccine, but it's definitely something that I would do completely separately from other ones. Do not let a vet convince you to get all vaccines at once. And just monitor your pet closely for any sort of side effects like lethargy, vomiting, or swelling in that area. That being said, the best probably defense to do against leptospirosis is just building the immune system with a healthy homemade diet, like the crock-pot diet. Like that's going to be the answer for everything else. Like The crock-fed diet because it's an anti-inflammatory diet. Gut health using a product like Megaspore, anti-inflammatory things like fish oil and things like that. Really, like the stronger the gut health is, the better all the immune system is fighting off bacterial things. In New York, I would just try to avoid puddles. Like I said, I was looking it up, and it's a pretty low rate of leptospirosis. So I wouldn't worry too much about it. I would just avoid the puddles. And charcoal is good. The activated charcoal really helps with absorbing endotoxins if your pet gets a stomach upset and things like that. I don't know if it's like something I would give my pet to prevent it from leptospirosis. I would just basically really work on the immune system with a fresh homemade diet, strengthening the gut, natural anti-inflammatories, and just avoid puddles, especially as a puppy, a 10-week-old puppy, and on the streets of New York, I basically would barely let that dog touch the ground at all. Until like there are vaccines that your pet does need to get, to protect themselves. Now, then it's just, the balancing out of how often should I get them? When should I get them? What can I do to support their body when they get them? Right. Streets of New York, 10-week-old puppy, that puppy would touch the ground for 5 seconds if it was me. Until they're vaccinated fully. So best bet is just to watch the puddles. I wouldn't worry about getting them vaccinated for leptospirosis in New York. Now, if you lived upstate and you had dogs that like ran around on all over the place and they got into puddles, that may be something to think about. But then if that's the case, then you can use something like Thuja, which is a homeopathic herbal remedy that helps the body detoxify and helps strengthen the liver and things like that. So then you would use that to support it. So yeah, I just feel like there's not enough cases, Kimberly, to really worry too much about it. But definitely, always watch your pet going in a puddle anyway, just to prevent any sort of diarrhea or bacterial infection that way. So I feel like there'd be more chance of getting diarrhea than leptospirosis, even in New York. So I used to live in New York City for 2 years, and I had I'll tell you this story really quickly. I was walking home from school. I went to school. I went to AMDA, and I was on Upper Broadway, and I was walking, and they were poisoning the rats. So they had like a subway street, and I was on the sidewalk here. So they were all these rats. I saw it had to be like, oh my gosh, like 50 rats out eating poison. And I like saw them, and I kept walking, and I scared them. And instead of running the other way or down, they ran towards me. And I literally was walking through a sea of rats. And if anybody's seen New York rats, it's basically like a sea of chihuahuas. And my friends were watching me, and they were just going, I've never seen anything like that in my whole life. I was going, oh my God. Oh my God. I could feel them hitting my leg. Like I almost tripped. It was incredible. I didn't get bit, thank goodness. All right. Kimberly Earhart has a little post here. Hi, I just want to introduce myself and share a photo. I took my 2 cane corsos. I love cane corsos. Diesel is a fawn, and Belladonna, yes, is the gray. Please tell me named after a Stevie Nicks album. I'm here to learn a better way for my pups. Awesome. We're here to help you, Kim. Let's see. Oh, I was Christina, this is a tough one. I was reading this one. So Christina had a question. Hello, I'm dealing with a pup. What seems like an allergic rash. They are almost 3 weeks old and are hairless Zolos, which are like the Mexican hairless guys, which are typically sensitive to foods being primitive. I'm assuming it's coming from mom's milk, as the one that wasn't taking formula has it. This is sort of the one that wasn't taking the formula has it the worst. Oh, your formula. And the one drinking lots of formula the least. However, the one with the worst breakout is also the smallest. I have supplement formula, as there only seems to be 3 using milk now on mom, and I can tell they aren't getting enough. They've seen 4 vets, 1 homeopathic, but most are unfamiliar with the breed, and 3 recommended chlorhexidine, which would burn their skin. Is that with that breed? Like, I know it's tough because I'm not really I've seen it a couple times when I worked in Los Angeles. But like it's not like I can tell you up and down about labs, but like a Xolo, I couldn't like because usually we would use a chlorhexidine solution, and like if you were going to use like just chlorhexidine, then it may burn the skin. But a lot of things like Duoxo wipes and things like that, they've got about 2% chlorhexidine. So with this is sort of like a more of a topical antibacterial. So would that burn the skin for one of those dogs? I mean, and it just could be the breed. Again, like you said, like just it's one of those tough things that we're not too familiar with these breeds. Homeopath has recommended topical solutions, but so far nothing has helped. Man. Mom had high levels of probiotics, but is a picky eater. I've removed chicken from her diet. Good call. She doesn't get egg or dairy. She primarily is eating beef, salmon, pork right now, only freeze-dried, limited ingredients, and grain-free. Thinking of making a DIY formula that doesn't include allergens, as everything I see that's commercial has whey, dairy, or grain. I've also started beef bone broth to add to it and wondering if anyone has recipe for puppy formula they can share. Any other suggestions? They seem healthy, eating, gaining weight, developing normally, but not have been doing. Well, that's good. You're doing a great job. Have you thought about doing, so one of the things that we recommend for clients, because I know that you're steering away from chicken, but you're doing beef, salmon, and pork. It may behoove you to do a Glacier Peaks allergy test on her. Let's see. So we have the pet wellness, Glacier Peaks Holistic Pet Wellness Life Stress Scan. So this is an at-home, you can get on Amazon, at-home allergy test that you just do at home. So you get a piece of saliva and then any small hair sample you can get from Mexican hairless. I know they've got hair in places, so and send it off, and it'll kind of give you just a little bit of a roadmap because that may be where to go. Because your thought process is brilliant. Like it's okay, the pet's having an allergy. And it's weird to think. Let me just show you what it looks like. I was going to show you what. So this is what it looks like, and I'll pop up with like, so we got, so here's all the proteins. So to light up whatever protein is active. And a lot of times proteins will come up that you don't think they're actually allergic to, but are. So that may be something to try. You may just want to do pork, only pork for a little bit, and see if that may be one that is okay. I know you're doing pork right now, but maybe just stick with pork instead of transitioning from beef, salmon to pork. Also, I was reading up, and I'm sure you know this, so I was looking at some other skin topicals. So there's gentamicin, betamethasone, which is a topical anti-infection, antifungal spray. So this may be a little more gentler on them if you're worried about the chlorhexidine, any of the chlorhex solutions. Also, I know that with hairless dogs, they tend to need to have not just necessarily a topical, but like an actual lotion. So if since you're familiar with the breed, maybe you just need to looking up lotions for your breed. So maybe just a natural thing. Like instead of like worrying about like, a vet one, just maybe doing like coconut oil. And like just really lotioning up the baby to help prevent rashes that way. So maybe it could be as simple just as that. Just the pet needs to be lotioned a little bit more since it's smaller. So yeah, that's a tough one though. hopefully those were helpful suggestions for you. Um, I'll throw in some tough ones. Start with the coconut oil. Let's see. Okay, let's see. All right. Maureen Clark Sullivan. Hi, I'm new to this group. I recently joined because my little boy is in palliative care. I'm so sorry. He has diabetes and Cushing's disease. Well, he is no longer treated by the vet. I just make him comfortable. Okay, he's been doing okay, except today there was a change, which is disturbing. He started throwing up his food, has not done this in a while. He drinks a little water. I will not be giving him insulin or his questions medication on an empty stomach. Hopefully, he'll sleep well through the night. We'll see how he's doing in the morning. Oh, okay, so you're just sort of, yeah, hang in there. It's tough. You just got to make him as comfortable as you can. Unfortunately, with palliative care, and Cushing's disease, you know, and diabetes, so he's got blood glucose levels going all over the place, on top of his adrenal system. So Cushing disease is when the uh, pineal gland is not monitoring the I can never say the word endocannabinoid steroids in the body well. The adrenal glands are overworking. They're overproducing corticosteroids, which in turn sort of puts the whole body out of whack. So usually you'll see increased liver enzymes, all sorts of things. You'll see more hunger. You'll see, so it's a combination of hunger, not being hungry, feeling sick. It's all sorts of things. And the medication trilostane can really help with that. So he's sort of battling that. He's kind of battling, probably elevated liver enzymes. He's battling his adrenal glands going all over the place. He's battling, feeling full, feeling hungry, all sorts of things. So, and the thing with palliative care is really tough. I don't know if any of you have had parents in palliative care, but as you know, or older pets, it's a 1 day, 1 minute at a time situation. One day they can be feeling great, the next day they can be feeling terrible. So it can be really exhausting. So just hang in there, Maureen. I'd be curious to know what I know he's on. He is on some. I will not be giving him his insulin or his quotation on empty stomach. Hopefully, he will sleep well through the night. You may also. Sorry, I kind of missed the question too. So he is on medication. So good. I probably would, if he's on trilostane, I probably would give that even on an empty stomach. You may also ask your vet for a medication called mirtazapine, which is an appetite stimulant. So you can have that available on days that he doesn't want to eat to get him eating so you can give him some medication. You also can try making the diets more bland. So if you're doing like a regular basic diet, you could just do something like chicken and rice or chicken and white potato or boiled beef and rice, boiled beef and white potato. And try that. So but like I said, it's the same. It's just gonna be really, really tough. So hang in there, Maureen. Okay, Karen, I have a 40-pound golden retriever mix that I believe ate the carcass and legs of a roasted chicken. My husband took the chicken out to feed our sick dog and went to take a nap and forgot that the chicken was sitting out on the counter. Meanwhile, it's always the husbands. Meanwhile, our golden ate the chicken, and my husband cannot find any remains of the chicken. What should we do for our dog? It is probably too late to induce vomiting. Yes, I would never induce vomiting. Never, never, unless it's a poison. If it's a bone, if it's ever a bone or glass or anything like object wise, never induce vomiting. That can make it 1,000 times worse. So I mean, honestly, this is one you bring to the vet. I know it was about 2 hours ago, but I would bring him to the vet just to make sure, because you don't know what he ate, what he chewed, what he didn't. So if he has a blockage, they can do x-rays and they can see. That way, if not, then you're safe to say, okay, well, let's just help him past whatever he possibly ate. I know it stings going to the vet these days just because of the weight, because of the price. But yeah, it's something, chicken bones, even though it's chicken, it is smaller. But I've just, experience has shown me that better safe than sorry in a situation like that, but never ever induce vomiting when your pet eats something like that. Only induce vomiting when it's a poison of some sort. So yeah, so hopefully your baby's doing okay. And hopefully he ate hopefully the chicken was eaten. So, but this is the thing too. So you say, oh, well, raw feeders, they throw raw. So there's a difference between raw bones and cooked bones, right? So raw bones could break a little easier as opposed to cooked bones become a little bit more rubbery and harder to break down. So those are actually where it can be a bit more dangerous. So, so yeah. All right, y'all. Oh, these are tough questions. Hopefully I helped you. I gave you some information, some ideas that you can take or not take. Keep us posted though. Oh, this poor kitty. Keep us posted. It's a tough one. This is a situation you just want to get the diagnoses first and then kind of go from there. But again, I'm pro prednisone in this situation, pro the gabapentin, anti the vaccine right now, but that's okay. It'll be all right. All right. Go back here. Lori's still watching. I know you probably want to have the lady with the puppies try powder. Oh my God. Okay, so Lori has a great suggestion. This is amazing. So she's got a private message. So have the lady, so powdered colostrum, if okay with the vet. That's a great idea to help with that puppy's rash. That's an awesome idea, Lori. Any other suggestions from anybody? For anybody? It's so frustrating, y'all, because Lori, I mean, just go to, oh, she's just laughing. All right. I know it was a lot of stuff I could have used you on this one. All right, let's see. Look at the chat here real quick. Oh my gosh. So Carrie can hear you. I can't hear you. Hold on.
If Carrie's still there, Carrie, can you hear me? You still can't hear me, can you?
So they can hear you, but I can't.
Oh, weird.
I can't, but they can.
Hi, Carrie.
Carrie says she can.
Oh my, we'll do it again another time.
I'm gonna call you real quick so I can hear you, and then I'm gonna have you. I want to talk about your website real quick because we still have. Because I want to make up for the 15 minutes that we lost, so you can get a chance to. So let me just call you so I can hear you. Hold on. Thank you so much, Carrie. I should have looked at the messages first.
Thank you, Carrie. Hello.
Hi. Okay, so now I can hear you.
Oh my God.
Oh, now we're gonna have like feedback.
I'll put my phone behind my back. Is that better?
All right. So I'm gonna open your website.
Okay.
And let you kind of talk about oops. Hold on. Just talk about your website and everything that you do. That's amazing.
Sure. Well, thank you. So Michael went through it earlier. As he said, I do canine massage, do my health, holistic pet health services. I make an all natural line. Sorry. I make an
Oh,
all
what'd you say?
natural line of pet grooming products, shampoos, paw balms, a soothing skin spray. Everything I make is all natural and vegan friendly ingredients. I started this my business. I'm a pediatric nurse by trade, but I started my business about 5 years ago because I had a rescue bulldog named Ike who passed away. And the last years of his life, I became very much more holistic. I was reading labels on products and food and everything. And I was just so discouraged. I was so discouraged that things that said organic and all natural were far from organic and all natural. You see all kinds of preservatives, and a DMDH is a big preservative, and that is actually formaldehyde. It really and it's used as preservative. So long story short, I wanted to truly, truly, truly develop an all natural line for dogs, and it took me a while. It trial and error. But so that's in a nutshell. It's like dedicated to my bulldog. It's like his legacy, and I just want to educate other pet parents all over the world about the power of nature. Natural healing, and working with your vet and working with the holistic health care providers like Michael and I and Devora. It's a good relationship. I mean, you still need to have your vet, and you can have holistic approach and marry them together, and then you have the perfect, to me, you have the perfect plan. So yeah, that's kind of it in a nutshell. I think there's about, I want to say 100 and I did research. I think there's 110 million, 118 million people that have gone holistic. They do acupuncture, they do massage, they do acupressure, they eat clean, they use essential oils, they use CBD. And those pet parents are wanting to do the same for their pets. And it's been a long time coming, and we're still not there. But we're going to get there. And so that's why I love this program and why I do what I do. And I came in and out again. I think I'm done because I keep going in and out. So.
Okay. I didn't want to interrupt. I can't hear her at all. So it's like, I'm so sorry.
No, you're fine.
Okay, great. Well, thank you, Lori.
Thank you, Carrie.
I'm so sorry. I'm gonna do this again so we can, you and I can go at some questions and everything or at some point, or we'll figure it out at some point.
Thank you for tuning in.
But I just want to make sure I had your website out there.
Yeah, thank you, Michael.
All right.
You can't hear me, but thank you. Bye.
Bye. Okay, y'all. Well, that is it. I'm going to apologize so much for the technical difficulties. Clearly on my part, I have no idea why I cannot hear her. But hopefully everything was helpful for today. And again, like I said, please check out Lori's website, peacefulpaws.com. You can check out my site, positive-wellness.com, for really cute puppy massage pictures and what I do. I'm a holistic pet health coach, so Lori and I can both help you via Zoom. That's what's great about the pet health coaching, is that you and I can talk for an hour about your pet. Our job is basically to have you fill out a form. You send your vet's records. We take a lot of time dissecting the records, looking over it, almost like a forensic investigation on the records, and then we can come up with a pet to help your help dietary wise, supplementation wise, and diagnoses through traditional Chinese veterinarian medicine wise. Just to give you tools. You don't have to use everything we give you, but we want to give you enough so that you're more educated on what's going on with your pet's condition, more educated to ask the correct questions for your vet, and to say, okay, well, my pet has this issue, so let me try this tool that Michael recommended or Lori recommended, or this tool that we recommended, or this diet. So thanks so much for your time, and y'all have a good week. Bye.